This week's Ask Dr. Durie comes from a patient who wants to know about the use of Activism, which is a trade name Ninlaro, which is an oral proteasome inhibitor. And so we have three proteasome inhibitors. We have bortezomib, which is Velcade and comes as a subcutaneous shot. And then we have carfilzomib, trade name Kyprolis, which comes as an intravenous infusion injection. And then we have ixazomib, which is Ninlaro, which is a by-mouth injection, but a by-mouth medication. So the question is, can this be a reasonable substitute? Is Ninlaro by mouth something that could be considered, particularly right now in this time of COVID-19 concerns, when patients are anxious about going in to the medical center or the doctor's office to get an IV infusion or to get a subcutaneous shot? And so the answer to this question is that, in fact, we do have data using Ninlaro in the frontline setting and for maintenance, and also in the relapse setting, and these data are really quite encouraging. Now, Ninlaro is not approved in the frontline setting. It's approved in the relapse setting. However, the data are sufficiently strong. For example, a study was conducted comparing Ninlaro, Revlimid and Dex versus Revlimid and Dex, and the results showed significantly better remissions and survival with the Ninlaro three-drug combination. And so, as an alternative, which is by mouth, which means that you don't need to go into the doctor's office to get an injection or infusion, this is something to talk to your doctor about. And the Ninlaro is available. And so it is definitely an option to switch out and use the Ninlaro as part of an induction. Maybe after the first few injections, Ninlaro could be used as an alternative. And certainly in the maintenance setting, where we actually have data indicating that Ninlaro does definitely prolong remissions, and obviously in the relapse setting. And so whatever the situation might be, the data are strong enough such that it is very, very reasonable to talk to your doctor and say, is this something that could be a safe alternative for me that can work and can be effective and can be well tolerated and means that I don't need to come in to the hospital or to the office as often and risk getting exposure to the COVID-19 virus. And so I think very, very important and potentially helpful discussion.